I want you to tell me when you hear my fingers, okay?
I hear it.
All right.
I hear it.
Okay. Cranial nerve 8, which is your acoustic auditory, is intact. Okay. And then the cranial nerve 9 is your glossopharyngeal. I want you to hold out your tongue. Okay. And I'm going to be testing your gag reflex. Okay. I'm just going to put my. All right. Okay. So cranial nerve 9, which is your glossopharyngeal, is intact. And your cranial nerve 10 is your vagus. And I'm going to put some water in here, and I want to observe you swallow.
Okay.
Okay. And I just want to have you to just sip just a little bit. All righty. So that lets me know cranial nerve 10, which is your vagus, and your uvula, it moved. Everything looks intact there. And cranial nerve number 11 is your spinal accessory. And I want you to shrug up your shoulders. Okay. And then I'm going to have you to turn your head, and I want you to resist my hand. Okay. So I want you to turn to that side.
Okay.
All right. And turn to this side. All right. Okay. So right there, the cranial nerve number 11, which is your spinal accessory, is intact. Okay, and then the very last one is your hypoglossal. And I'm going to have you to move your tongue side to side and stick out your tongue again. Okay, so move it side to side. Okay, and stick it out, and everything there. And cranial nerve number 12 is your hypoglossal, and it's intact. Okay, and I've already observed your talking, so you have no abnormal articulation in words. Okay. So right there, the cranial nerves are good, okay? Once again, we're going to look at your skin. I've already looked that over, and I'm going to be looking at your back. I'm going to be coming over to your posterior part of your body and checking that, okay? All right. Okay, so you can turn it off and see how we do it. All right, your head is round, symmetric, okay, and normal looking to me. Okay. The next thing that I'm going to be doing is I'm going to be inspecting your mouth. Okay. Right now, look at your little lips, and your lips are brown in color. Okay, and soft. No problems there. And then we're going to be looking inside of the mouth. Okay. So, like I said, your lips symmetrical. Okay, brown in color. Texture is soft. No lesions, no masses, no rashes or irritation is seen. Okay. So just open your mouth. Okay. Teeth look good, clean. Okay. So the teeth are even, white. No missing teeth I didn't see or anything. And so I'm going to be inspecting the inner part of the lips. Okay. So you'll just open up. Okay. And I'm just feeling around in here. Okay. All right. The lips inside, the integrity is smooth and soft to me. Color pink inside, moist, and no lesions or ulcers or sores or anything is seen inside of the mouth. And so next thing I'm going to do is have you to stick your tongue out, and I'm going to be touching your tongue. Okay, so stick your tongue out. All right. Tongue is, the texture of it is soft. No nodules, no masses, no discolorations or lesions are on the tongue. And the tonsils were pink and a 1+. Okay? Next thing I'm going to be doing is I'm going to be inspecting your nose, and I'm going to check your frontal sinuses and your maxillary sinuses. Okay? So your nose right now, there's no deviation, symmetric, midline. No discharge is seen in the nose. And so I'm going to be applying pressure to each side of your nostril. So I'm going to be touching here, and I'm going to be touching here. Okay, and I'm going to have you to snip. Okay, so that let me know the nose is patent. Okay, no deviation at all, and no tenderness was felt.
No.
Okay, good, good. Okay, so right now I'm going to be shining a light, and I'm going to shine it over. This is your frontal sinuses. This is your maxillary. Do you have any problem with sinuses?
No.
Okay. Well, I'm going to shine the light here. I'm just covering up so I can look in here. And I'm going to be looking here. Okay. Now I'm going to have you to open up your mouth. Okay. Alrighty then. So that right there, I looked inside of your mouth with that, and the maxillary sinuses look good, patent and everything, and there was nothing seen inside of there. Okay, everything looked good. I'm going to palpate your trachea, and so how I'm going to do that is I'm going to be putting my fingers on your trachea area right here, and I'm going to be looking for a deviation in that. Okay, so I'm going to be touching. All right, so the trachea, I use my fingers, and I'm going to do it one more time. I'm using my thumb. Okay, it's midline, no deviation. Okay, I'm going to be touching your chest. And I'm just checking your chest and make sure there's no masses or lesions. And there is no masses and no lesions, bulges, and your chest looks symmetrical to me. Okay? All right. Inspect the nose one more time. So I'm going to be looking in the nostril. There we go. There we go. Alrighty then. The nostrils, there was no discharge or anything. I just want to apply some pressure. Alrighty then. So with the nostrils, I know they're patent. And so I want to transilluminate your sinus area again. You told me you had no sinus problems, but I just want to check and make sure that there is no problems going on with your sinuses, okay? You know the sinuses, they function to warm and cleanse the air before it goes down to your lungs, okay? So what I'm going to have you to do is I'm going to have you to open your mouth, okay? All right. And I'm going to be just these right here, frontal, maxillary. All righty then. Okay, and I'm just going to cover the eye there and see. Okay. All right, so the sinuses, when I transilluminated, there was nothing abnormal inside of these sinuses, okay? And the next thing we're going to be doing is I'm going to be checking your chest area. So let me take off my gloves and wash my hands, and then we're going to check your chest out. Okay, sounds good. So you're having a good day so far?
We're having a good day.
Good, good, good. Okay, just wash my hands, and I'm going to be looking at your chest, seeing the movements. I want you to breathe in and out. I'm just inspecting your chest area, and the chest area is symmetrical and movement is equal, okay? And then the next thing I'm going to be doing is going in the back of your chest, and I'm going to be checking your thoracic expansion, okay? Okay. So you can just come over here with the camera a little bit. Okay. I'm going to have you to lift up on your gown just a little bit here. Okay. Alrighty. And I know this is just for video purposes, but if this was my real patient, I will be having no clothes on this patient, but I don't want to disrobe her. So right now I'm going to be putting my hands here, okay? And I'm going to have you to breathe in. All right. Okay, and breathe out. Do it one more time. Okay. The chest is equal, has equal movement, and no abnormalities on the when you breathe in with inspiration or breathe out, okay? And my thumbs, when I had them here, they were moving equally apart, okay? There was no pain when I did that, okay? There was no fractured ribs or any chest wall injury, okay? Your spine, normally I'm going to have you to bend over just a little bit, okay? Spine is normal, okay? Straight. And your skin, I don't feel any bulges, any masses, okay, in the skin. and no lesions are seen, no moles are seen, okay? And the next thing I'm going to be doing is I'm going to put my hands on your back side of your posterior chest. And you're just going to feel me palpating here. Okay. Even, smooth. Breathe in. Okay. All right. Everything looks normal there. And I'm going to put my hands here and I'm going to have you to say the word 99.
99.
Okay. Say it again.
99.
Say it again.
99. 99.
All right. That I was just checking for adventitious sounds. There was no adventitious signs when I placed my hands over your right and this is your right and your left lung field. Okay. Sound was resonance and it was loud in intensity, low in pitch. No hollow. It was a hollow sound in quality. Okay. And so the next thing I'm going to be doing is percuss. And I'm going to be just feeling on your back side.
Okay.
And so you're going to be feeling me. Okay. There when I did that on your back side with my fingers there, I percussed for any type of tenderness, and you didn't say that anything was tender. And it was resonant over the lung fields, and it was dull over the bony areas, and well, it was in flat. Okay. And then the next thing I'm going to do is I'm going to be listening with my stethoscope, and I'm going to be auscultating your lungs and all your lung fields, okay? Okay. Breathe in. Breathe out. Breathe in. Breathe out. Oh, okay. Right. All right, sounds good. And I'm going to move to the front.
Oh, that baby's so
The
nice. I'm so
inter- Good. All right. Oh. All right. So there I listened to your lungs there, okay? And I auscultated in all lobes of the lungs bilaterally. Breath sounds were vesicular, clear breath sounds. I heard no wheezing, no stridor, no bronchi, no pleural rub, and no adventitious sounds. If an adventitious sound was heard, I would be having you to cough, and I would do further testing.
Okay.
Okay, you can shut it off now. There. Okay. I'm going to be checking the your heart and your chest area. Okay. So I'm going to put my stethoscope on, and I'm going to listen with the diaphragm of my stethoscope. Okay. And this right here is your aortic, and I need you to just be still. I'm just listening to your heart. This is your and right here. This is the aortic area. I hear that heartbeat. All right. And then we're going to listen here. This is the pulmonic. We're going to listen here at the herbs point. I hear that. And tricuspid. And listen here, the fifth intercostal space. And this will be the apical. And I'm going to listen here for 60 seconds. Okay, for 60 seconds. And the rate was regular at 94. And the rhythm was regular. And the intensity was strong. And frequency was normal, and I heard an S1 and S2. But I'm going to have you to lie down.
Okay.
Over here. And I'm going to have you to come to the left side. Well, on your left side, because I'm going to check the apex of the heart.
So now my left side.
Mm-hmm. Okay. Let's check it with the bell. S1 is normal. S2 normal. There's no S3 murmur heard or S4.
Okay.
If I was to hear any extra heart sounds in her, it may indicate disease, or you normally hear that with a child or somebody who is pregnant. And I'm going to have you to sit up, and we're going to be talking about your breast.
Okay.
And I wanted to ask, do you perform breast exams?
Yes,
Okay. And on your breast exams, you do it monthly?
Mm-hmm.
Have any discharge, any masses, any dimpling?
No.
Okay. Now, I want you to demonstrate to me how you palpate your breast.
Oh.
You do it in a circular motion?
Yeah.
Kind of like this?
I can start at my nipple and just go around like that.
Okay.
And hold this arm up like
Mhm.
that, and and feel under my arm.
Yeah, right up here, up under the axilla. Okay, and you utilize the circular motions, pads of your fingers for your breast exam. And really, you just need to be doing that monthly and making sure that you see your physician for a yearly annual exam on that.
Okay.
I'm going to need you to lie down. I'm going to be checking your abdomen.
Okay.
Okay, and I'm going to be looking at the abdomen, the shape and the size of your abdomen. Okay. Okay, now I'm just going to be moving around up in here. The abdomen is soft, flat. If this was a regular patient, I will have the abdomen exposed, and I will be checking for any lesions, any masses, moles, scars, ascites, or any type of pulsations or rashes on the abdomen. So the next thing that I'm going to be doing is I'm going to be palpating. I've already palpated for lesions, moles, rashes, bumps or anything. So the next thing I'm going to be doing is I'm going to be palpating your kidneys. Okay, so you're going to just feel my hand over here. Okay, that'll be your left side. I'm going to be putting my hand here, your right side. Okay, and then I'm going to be palpating the kidney. I mean, not the kidney, I'm sorry, your liver. Okay, and so you're going to be feeling me here. The kidney should not be palpable, but I'm going to be feeling here. I'm sorry if I'm hurting you, let me know. Okay, and the kidney is about right here, and the kidney is the I mean, not the kidney, the liver. I don't know why I keep calling it the kidney, but it's your liver.
Okay.
And the liver is about 6 centimeters in diameter, and that is normal for an adult, okay? And so now I'm going to be listening to your abdomen. And so I don't know if you've ate or anything, but I'm going to be listening.
All right.
Okay, this will be the right lower quadrant, right upper quadrant. Oh, I heard something there. Left upper quadrant and left lower quadrant. Okay. Okay. Wasn't something beeping? Okay. I'm sorry, Kelsey. I'm glad Denise gave me the cue.
Wait a minute. Hold on. Okay, wait a minute. Am I think I'm still recording.
Okay. Okay, and I'm gonna listen here, and I'm just listening to see if I hear any thrilling noise like a bruit or anything in the aortic area. And then I'm gonna put it here, and then you're gonna feel me here, and this is your femoral area.
Okay.
No bruit is heard at all, okay? And the next thing I'm going to be doing is I'm going to be percussing, like how I did on your back. And so you're going to be just kind of feeling me here, okay? Let me know if I'm hurting you. Okay, I have cussed in the abdomen, and I didn't feel anything. I just felt like a tympany or something in there in the abdomen, but no abnormalities at all. Okay, and so the next thing we're going to be doing is I'm going to have you to sit up, and I'm going to be looking at your lower extremities.
All right.
And on your lower extremities, I'm going to be palpating your pulses, okay? And so I'm going to take off your little shoes if that's okay.
yeah.
I don't know if you tie them or not, so I don't want, but I know I don't. I just slip my feet in them. They tie all the time for me.
Sometime I do.
Okay. Oh, I love those socks. Oh, all right then. Okay. And I'm just going to be looking at these little bitty legs here and checking for edema.
She said a little bit of leg.
Yeah, and there is no edema in your legs. And then I'm going to check here. I'm going to feel your pulse here. This is your dorsalis pedis. Ooh, I got my hand right on it. Sometimes these are hard to feel, but yours is right there, okay? And then this here, I'm going to be feeling 2+. Okay, 2+ on that, and that right there was your when I did it here, this was your dorsalis pedis, and it was 2+ and 2+. This was 2+. This is your dorsalis pedis, and this is the popliteal. The posterior tibial pulses, and it's 2+. And then this right here is the popliteal, and you're just gonna feel me up under here. Okay. And these are kind of hard to feel, but it's real, like about a 1+ on that. Okay, and I checked for edema. Feet is normal, no abnormalities. No tenderness was felt, and no deformities in your feet. And the next thing that I need to do is I need to do your carotids, because before I had you to lay down, I didn't check your carotid pulse. Okay? So I'm going to be putting on my little ear pluggies here. Okay? And I'm going to check here on your left side. And this here, normal. Carotids are normal, no bruit or anything is heard in that. And so I'm going to check your range of motion for strength in your lower extremities. So I'm going to put my hands here and you push down on it hard. Oh, righty then. And go against me. Okay, and kind of move your legs around. Make sure you have good range of motion. Okay, so the strength on the lower extremities was about a 5, which is normal. We usually do that on a scale of 0 to 5, okay? So I'm going to take my little hammer that I have. I believe that what I do with my little hammer. And I'm going to check your reflexes, okay? And let's check your triceps. And I'm going to be doing it with this little hammer here. Okay. So you're going to just feel me tap you, okay?
Okay.
And I'm just checking your reflexes bilaterally. Okay. That's your tricep. Okay. Okay. And then I'm going to be checking the next one, which is your biceps, okay?
Okay.
And this is where I'm going to be doing this little bone here on the back. All right. Tap it again, and those were 2+ and normal. And then I'm going to do your brachioradial. So I'm going to hold your hand here. Okay. And those were 2+ bilaterally. Okay. And then the next thing I'm going to be doing is your patella. Okay. And on the patella, I'm going to be two plus bilaterally. And then the next one, okay, and we're going to check the Achilles, okay? So I'm going to hold your foot. All right, good reflexes. All right, the Achilles is 2+, and then we're going to check the popliteal. So you're going to, I know you're used to this. All right, 2+. Okay, 2+. So your deep tendon reflexes are fine. The next thing we're going to be doing is your cerebral motor. I want to check and make sure that that is intact. And so I'm going to have you two stand up. And I'm going to check if you will walk towards me like heel to toe.
Oh, okay.
Heel to toe, heel to toe. Okay. All right, and then walk back to the bed. Good, good. Now I want you to turn around and hop to me.
Hop.
Yeah.
Bunny
Hop.
bunny
Yeah.
hop.
All right, and then hop right back. All right. Okay, the cerebral motor function is intact. Okay, and go ahead and sit back down, and I'm going to place something in your hand. And this, what I'm testing now, is going to be her neural sensory to make sure that it's intact. And I'm going to be checking the sterognosis. And so I'm going to be placing something in her hand, and I want her to identify what I'm putting in her hand. Okay, so go ahead and close your eyes. Okay, and what do you feel in your hand?
Like a piece of metal, like a piece of wire.
Okay, open up your eyes, and it's a paper clip, which is a piece of wire. Okay, and then the next thing that I'm going to be testing is I'm going to write a number inside of your hand. Okay, so close your eyes, and what number am I? Did you feel that?
Is that a 2?
It is. It is a 2. And so that was what I just checked was the graphesthesia, and that is intact with your neurosensory. And the last thing that we're going to do in your annual checkup today is I'm going to test your cognitive function, making sure your cognitive function is intact. So what is the time now?
What is the time? 2:18.
Okay, and what place are we at?
Doctor's Specialty Hospital.
All right, and what is your name?
Cynthia Gruber.
Okay, all right, and your attention span was normal throughout this whole annual assessment. And I'm going to ask you 2 questions about your recent memory. What did we when I tested you, when you stood up, what did I have you to do towards me?
Walk towards you, heel to toe.
Okay. And the remote memory, I want to check that with you. Who was our president in, let's see here, 2000 and, let's say 2006, 2007?
7. Oh, that was Bill Clinton.
Okay, well then, good. Her remote memory is intact, so her cognitive function is normal. Well, I thank you very much, ma'am, for letting me do this assessment with you today. And I'm going to leave you now. I'm going to pull the curtain and have you to take your gown off. And once again, do not forget to come back and see us for your next annual exam.
Okay.
Okay, thank you.
Okay.
And I'm going to check for a reflex in your foot, and this is called a Babinski reflex. And so what I'm going to be doing is I'm going to go on a circular motion on the bottom of your feet, okay? And I'm just going to see your
Okay.
all right. Okay. So that lets me know that you have a negative Babinski reflex, okay? And the next thing I'm going to do is I'm going to check your vowel sounds in your abdomen, okay? And I'm going to be using the stethoscope, and this is your right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay, so I checked all 4 quadrants in your abdomen, and your bowel sounds were hyperactive. Let me know that everything is moving fine, and that there was no absent vowel sounds. If I would not have been able to hear something, that would have let me know that there may have been an indication that possibly you may have an ileus. That's what we call a intestinal obstruction. Okay, so I'm going to go ahead and have you to sit up.
Okay.
And I am going to be palpating your temporal pulse. And what I'm going to be doing, your temporal pulse is right here. And so I'm going to be putting the tips or pads of these fingers right here. And I'm just going to palpate. And this is on your left side. All right. And it's about, it was kind of light, so I'm going to say 1+ on the temporal, okay? And the next thing I'm going to be doing is I'm going to be auscultating your carotids, and I'm going to do one at a time, and I'm going to be using the little small area, which is the bell of my stethoscope, okay? So I'm going to twist that, and I'm going to have you to hold breath. Hold breath. Okay. And I'm going to check again on this side, on the right side. Okay. I didn't hear any. It's kind of like if I hear a bruit, it's like a swishing sound, and I did not hear any swishing sound or anything. Because bruits, they are low pitched. Blowing sounds, and they may indicate arteriosclerosis. So I did not do that, hear anything. Now, on your breast exam, okay, I'm just going to show you how you should be doing a breast exam. And so I'm going to be using these fingers here, and I'm going to palpate your breast, okay? So on your right breast, you're going to go in a circular motion like this, okay? And you're going to go round and round all the way to the nipple area. And then you're going to do it again here on this left side, okay? And I'm just going in a circular motion with the tips of my fingers. No tenderness is felt. You haven't had any discharge or anything. So you'll do that to your breast every month, and then you'll have your annual exam, okay? The next thing I'm going to do is I'm going to be checking your heart sounds. So I'm going to put my little ears back on, but I'm going to check out with the diaphragm, which is the big part, okay? All right. This is your aortic, and this is in the second intercostal space, your aortic valve area. Okay, and then over here, your pulmonic, and this is in the second intercostal space. And then we're going to go for your tricuspid, and the tricuspid is in the fourth intercostal space. And then Erb's point. And Erb's point is located here, and this is in the third intercostal space. And then we'll be checking your, right here, this is your apical, or we call it your mitral. This is in the fifth intercostal space. Okay, so I heard S1 and S2, which is over the fifth intercostal space, and that just indicates to me like S1 is the shutting of the valves, and it's best heard at the top or the base of the. Okay, I'm going to listen to your heart with the bell. Okay, and this is the aortic, second intercostal space. The pulmonic valve, second intercostal space. Tricuspid, fourth intercostal space. Erb's point, this will be your third intercostal space. And then I'm going to listen here, I'm so sorry, ma'am. And I'm going to listen here in the fifth intercostal space for your apical pulse, and we usually listen here for 60 seconds. Okay, so I did not hear, even with the bell, I did not hear any extra heart sounds. And if I would have heard any extra heart sounds, that would let me know that, like if I would have heard an S3, that could be mainly congestive heart failure. If I would have heard S4, that could have meant you had an enlarged heart. So I did not hear any of those. And the S1 I did hear over your fifth intercostal space. And the S2 I heard at the top of the base of your heart. Okay? I want to palpate that temporal pulse one more time because I forgot to explain to you that I'm going, when I palpate one side at a time, we have to do this for precautionary measures, because if we do more than one pulse at a time, we can reduce your blood flow to your brain, and we don't want to do that. So that's why we do one side at a time. Okay? And like I said, it's 1 plus kind of weak there for me. The next thing I'm going to do is just have you just sit here, okay? And I am going to go ahead and I'm going to be percussing your kidneys for the costovertebral tenderness right here in the back. Okay? Yeah, I'm going to need you to come around here for that, if you can. I don't know if you can. And how I'm going to do that, I'm going to be checking for costovertebral angle tenderness. And I'm going to use the fist of my hand, and I'm going to just hit on the right side of your kidney and the left side of your kidney, okay? So here I am on your left side, and I got my fist here. Any tenderness? Okay. Any tenderness?
No.
Okay. I'm going to do it one more time. Tenderness?
No.
Tenderness?
No.
Okay. If I would have felt any tenderness on your right or your left kidney, that would have told me that there may be an indication you may be having some pyelonephritis. Okay? All righty then. That's it. That's it, Ron. That's it.
No, we should do the last